Starpharma's docetaxel is a new formulation of an existing cancer drug called docetaxel, or Taxotere, that's the marketed name. And what we're doing is we have our dendrimer delivery technology, which is a proprietary technology developed in Australia, and we're using that delivery technology to improve the performance of the cancer drug docetaxel. And so our version of that formulation is docetaxel.
The overall approach to common cancers such as breast cancer, colon cancer and lung cancer generally involves surgery to start with to remove the main tumour mass, and then subsequently, in many cases, radiation and chemotherapy are used to try to mop up any residual tumour cells and to try to improve the patient's chances of cure. Taxotere can cause low white blood cells and dangerous infections. There can be a need for transfusions. It can cause toxicity to the gastrointestinal tract. It can cause damage to nerves, to skin. It often causes hair loss. So improving the side effect profile of chemotherapy is really important. A drug that's less toxic will allow us to go to a higher dose and potentially a more effective dose.
The dendrimer technology allows it to target the tumour tissue, so 40 to 60 times more cancer drug gets into the cancer tissue. We haven't seen in patients in our current trial, for instance, neutropenia or bone marrow toxicity, which results in white cell toxicity, and we haven't seen hair loss, and we haven't seen vomiting and diarrhoea. We have very good efficacy improvement using docetaxel in animal models. We're still exploring the efficacy improvement in humans, and that'll need to be done through clinical trials. But we do know in animals we get marked improvement in the efficacy of docetaxel compared to the usual form of the drug.
The tolerability of docetaxel appears good so far. There have been no changes of any significance in the blood counts, no infections. There have been no gastrointestinal toxicity or hair loss or nail changes.
We've got just over 50% of patients in. We've seen very good tolerability, and importantly, we are now dosing patients at a dose which is in excess of the typical dose that's used for this drug Taxotere. And that's significant because we're actually not seeing the typical side effects that you would expect to see at these doses in our patients, which is a very encouraging sign.